Back on 535, it's Scott McFarland, joined now by Congresswoman Sydney Kamlager-Dove, Judiciary Committee member from Los Angeles, the City of Angels. You got about a third of the city in your district.
I do.
And that is a heck of a commute you have built for yourself to serve your constituents.
Amen to that, Scott. It's an honor to serve. I don't know if I'm saying that the entire 5 hours I'm on the plane, but I certainly stay when I get back home, and I feel the pressure when I'm here to deliver for my constituents and the American people.
Let's talk about the bill that has gotten our attention, the Pregnant Women in Custody legislation. This is a maternal health piece of legislation that expands what's been proposed in the past. Start off, Congresswoman, tell us what this includes.
So first, I'm just so glad that you're interested because real talk, women are incarcerated every single day. But we never think about it because when we're thinking about jails and prisons and detention facilities, oftentimes we're thinking about men.
Yep.
But the fastest growing population in our prisons are women, up 600%. And the majority of the women that are incarcerated or detained are mothers. They're either pregnant or they are nursing or they are mothers. And so my bill recognizes this reality, and is proposing guardrails on how we can, acknowledge the fact that women and pregnant women and nursing women are being detained, and B, what kinds of transparency we need, what kinds of administrative accounting we need, and how we can provide better services for them.
The proposals in the past addressed women who are in Federal Bureau of Prisons custody. That's part of your jurisdiction. That is your jurisdiction.
Right.
This expands for another subset of expectant moms who are in some form of custody.
Correct. So the original bill was about folks that were in federal facilities. And we know that they're being shackled when they're giving birth. We know that if they're having complicated pregnancies, they're not getting the help they need. We know that if they're suffering from postpartum depression, they're also not getting the medical attention they need. Obviously, what we have seen over the course of these past months with ICE and Border Patrol, we know that women are being detained in these detention facilities. They are also pregnant. A report came out that said over 350 women pregnant postpartum nursing reported 16 miscarriages because CBP and ICE are not doing their job. So my bill brought back to expand to include these agencies to really address the inhumanity that we're seeing coming from these agencies.
Some of this correctional work is subcontracted or contracted out to private employers, private companies. How does the legislation get after that? I can see how you'd have direct oversight over what CBP does in its own operated facility or what the Bureau of Prisons does at the federal prisons in California and elsewhere. But how are you getting after the contractors who get this work offloaded on them?
Well, so it doesn't matter because at the end of the day, it's all federal dollars. It's taxpayer dollars that are being used. So yes, in many instances, they're contracting with a private entity that's actually running the facility. But they still have to be subject to congressional federal oversight. They still have to do reporting. We still need an accounting of what they're offering, and they should be required to provide the same kind of services that the federal government would be if it was running the entire facility. And we know that this isn't true because they're being cheap and inhumane in how they are operating these facilities, and as a result, women are dying. Children are being separated, miscarriages are happening, and that's not something that should happen. Now, I should say that under the Biden administration, they had a policy that said they would not detain or deport pregnant women, but the Trump administration reversed that, which is why I think we're seeing these numbers, and we don't even know if these are the real numbers. These are just the numbers that we've been getting when pushing the administration.
Is this an indication, the argument you're making, of unique negligence of women's health? Or what I hear that some people are concerned about any health care in prison, that men would also be disadvantaged in whatever their unique needs are.
It is, and it's also recognizing that we have a court system that is not meeting the needs of the folks that are entering into these prisons and facilities. And so my bill is really to take a more collaborative approach to how we're dealing with folks who are incarcerated. And given the fact that women are the fastest growing population, I think it's important that we start with them. And hoping that a high tide will rise all boats, even for the men who are incarcerated as well.
You mentioned the report about I think the NBC reported about 350 cases. Is there more data you're bringing to the table to try to convince your colleagues to either join your legislation or to help champion it back home with their constituents?
Yeah, so before I came to Congress, I worked on this issue when I was in the state legislature, and what we learned was that women were not given tampons or menstrual products. We learned that they were not getting bras and underwear. We were learning that they were not getting access to OBGYN care.
Were they undercounting how many women were going to be in custody? Were they not being mindful of the fact that is a growing population?
I would say it was just negligence. They were saying we don't have the money. This isn't something we were thinking of. And quite honestly, they were saying, well, you all didn't ask. So I said, well, I'm going to start asking. I want to know the number of women that are being sexually assaulted when they come. I want to know the number of women who came in not pregnant and then all of a sudden miraculously became pregnant. I want to know the number of women who are working in law enforcement and in the prisons, or how they are being trained, how the men wardens are being trained. I want to know what kind of food they're being given, medical attention they're being given, vocational training they're being given. I want to know if you're asking them about their trauma, how they got here, because in the majority of instances, women are in prison because of a man or a partner that they were sort of hooked up with for economic reasons often, and they end up with stiffer penalties. So I said, you know what, I'm gonna start asking all the questions. I shouldn't have to do that, but that's my job.
I used to work years ago in a local newsroom where I would try to do reporting on issues involving corrections. I had an editor who said, nobody cares about people in jail. You're not going to get the audience's attention. I suspect you feel some symmetrical dynamic when you try to get people's attention about issues involving those who are housed in correctional facilities versus other people you help represent.
Yeah, the reality is a lot of us know somebody who's been touched by the carceral system, but it's not a story we want to share because there's a lot of shame that's connected to it. And we think, well, these folks have disappeared and then miraculously they're going to re-enter our community and they're going to be fine. And that is not the story the majority of the time. You have women who are incarcerated, and what's happening to their kids? Who's taking care of their kids? Do they end up in foster care? Do they get adopted out? Does the parent know that? Do they have privileges where they can visit them? What happens when someone in your family dies? Are you allowed a privilege to at least even phone into the funeral? I mean, these are like basic things that we should be thinking about. The trauma that got you in here. Let's be a little more collaborative about the vocational training that you need. Are they being trained to do a skill that they're not going to need when they get out, and then you expect them to be successful upon reentry? I mean, come on. Are we then sending them back to the community that actually sent them to the jail or prison in the first place? Like, let's have some real conversations about this, because you know what? It costs a lot of money to run these correctional facilities. And my hope is that we can spend less because fewer people are going in them.
Effective reentry prevents recidivism, or at least minimizes that, which is a cost savings. I want to ask you broadly about maternal health. It's been a priority of yours, both at the state and now that you're here in the Congress. Do you have an easier time extending the bipartisan olive branch on issues involving maternal health? Because it charitably seems to be viewed as non-political, much less charged than other issues.
It's interesting. In an ideal world, I would have Republicans on all of the bills that I'm championing in this area, but it has become so partisan that now it's hard to find it. But I tell you, there are Republican women and Democratic women in Congress who are pregnant or who just had a child. And many of them share stories about complicated pregnancies, about miscarriages, about stillbirths, about the trauma of giving birth. It is still a very dangerous proposition. So if you each have these stories as Republicans and Democrats, then why couldn't we work together more often on addressing maternal health issues? I don't understand why many of these women don't want to be part of this larger conversation when you're talking to the American people.
Is there something they view as political in some of your proposals?
Well, I will say,
there must be something they see as unappealing.
I think the political part is that it's being authored by a Democratic woman from a blue state. But I will tell you, I worked with...
Would they call some of it an unfunded mandate on local jurisdictions?
Some of them do. Some of them want to suggest that we shouldn't be offering these kinds of services to certain women. I think there's an assumption that the majority of the services would go to Black and brown women, since the majority of women that are incarcerated tend to be Black and brown. But we can extrapolate and just go back to maternal health for everyone and Republicans should be on board. And then you have a politicized anecdote about how, I as a Republican had challenges getting health care in my district because Democrats politicized maternal health and have made my doctor afraid to provide the kind of care that I need during my pregnancy. I mean, I actually have heard that from a Republican colleague, and I said, well, you're politicizing your healthcare journey, because there are so many women, RSDs, independents, you name it, who are going to doctors, who are having complicated pregnancies, and who want a doctor who can address their needs and give them the healthcare they deserve.
So what do you do? How do you calibrate it to make it more appealing? To get sufficient votes for one of these things to pass?
Yeah. You remind folks about the stories that we all have in each of our districts, and that they're really agnostic in terms of party, but they should be addressed. You talk about what the carceral systems look like in each of our states. You share stories of women who have gone through the system, and many of their stories are very traumatic, and they're just asking for us to work together to help solve those problems. And you work really hard. What I try to do is work really hard to connect to the humanity of my Republican colleagues. And in many instances, it's there. You just have to pull really hard to get it out. And then design bills that are nonpartisan, that are agnostic.
What are some of the other maternal health proposals you've offered or think about offering in the months ahead?
I think it's incredibly important that we are funding training and education in our medical schools. We know that bias exists. We know that women don't get the services that we all need, because really this healthcare system is designed for men and not women. I say it all the time, how we are prescribed. I'm really interested in looking at senior women. They think that once you're of a certain age, you're not sexual, you don't want to be intimate, and so they stop offering you OBGYN care on a regular basis. I think that is bad and wrong. And just interested in how we can continue to provide more resources and access for our new mothers, many of whom are working, and it's really hard for them to afford formula and food for their babies. And how are we supporting them? It's pre, post, pregnancy. It's the full cycle of a woman and a child.
When it comes to the cutbacks the federal government has made to so many of these agencies, and the Health and Human Services has suffered quite a bit, the buyouts have gutted so many other agencies. Is there a need to address this in the appropriations process moving forward to get more funding and get more grants out to your community?
Absolutely. During the shutdown and when we were debating HR 1, I was going to WIC clinics, and I was crying at each stop I made, because they were saying we're going to cut the money we give to new mothers to buy food and vegetables for their babies, or that they weren't coming in because they were scared that they would be attacked by an ICE agent and deported. And we're having those conversations, and then now we're having conversations about a $1.8 billion ballroom just for one individual, when how much of that could go to school lunches, how much of that could go to EBT and food stamps, how much of that could go to health clinics to keep them open. In my district, 50 community clinics could close because of HR 1, and a couple of hospitals. So what does that look like for new families and new moms and little kids?
We've heard from a number of your colleagues, including inside the CDC, about rural hospital shortages, the closures of rural hospitals, the shortage, the deserts of providers. You're in a major city where presumably you have more money circulating or more providers available. Do you have a shortage?
Yes, sir.
How pronounced is it?
It's incredibly pronounced. So I have a hospital right outside my district. It's a glossy one, and over 50% of the patients they see are indigent care. Mm-hmm. I didn't know that. I talked to the hospital and they said, well, we're not going to close down, but what we are tracking are the 3 or 4 hospitals that are proximate to us that are. And so we're going to be hemorrhaging because we're going to have to take their patients. And we're looking at 2/3 of our patient care will be indigent. I have had numerous conversations with community clinics who are struggling to keep the doors open. So what does that mean? It means fewer providers that look like you, fewer providers that are closer to you.
I would assume fewer providers.
Yeah.
You want any part of that?
I mean, most providers are like, I'm in it for the long term because I took the Hippocratic Oath and I want to provide care. But what they're also saying is, I still also have to feed my family, and the reimbursements are getting lower. The patient care is getting more acute because folks are waiting longer to come to us because they really can't afford to get here, and that's problematic. So locally, we're sort of taking this issue into our own hands to try and find solutions, but it's not the job of every county, city, or state to do this. It really is the obligation of the federal government.
Something you can do if you get a gavel in January, or your party does, with your committees to try to mechanize some of this.
Well, my first thought was I want to hit somebody in the head with it because I'm so mad, but I won't do that. I won't do that. But we are going to have to subpoena everybody and bring everybody in and open the book. So as it relates to health care, you know, how much has actually been allocated? Where has it really gone? Let me see the metrics. You know, have you seen drops in some of these really bad statistics that are plaguing my community, rural communities and urban communities? Because people say, I pay taxes, so I want to see them go to something. And healthcare, I think, is incredibly prevalent right now and on everyone's mind. So I think every single person, if you're CDC, if you're HHS, Department of Ag, needs to come in and tell us how you are serving the American people. My suspicion is that because many of these agencies have been gutted, they're not. They're doing the bare minimum, which is why people are getting poorer, people are getting sicker, and people are getting madder.
Just a few minutes left, so we have to enter our speed round.
Okay.
The speed round's fun, I promise you.
Okay.
I mean, I promise you, but I can't really guarantee I'm going to deliver.
I rise with the intention of disrupting the normal business.
I ask unanimous consent.
I ask unanimous consent.
The senator from Nebraska is recognized.
The gentlelady is recognized.
The gentleman is recognized for 1 minute.
We ask members about their districts. If I go into your district in California, what is the best food that people don't know about, or the best food that you go to? Or we're taking you out for your birthday. Where are we taking you?
You're going to take me to a taco truck.
Okay.
Probably Leo's, probably in Mid-City, and we're going to stay there all damn day.
I'm sorry. The truck, it sounds cheaper. I'm not going to lie, which is not.
It's kind of not sometimes.
Okay.
There's some cuisines. There's some like Michelin star trucks.
All right.
I might make you take me to Whole Box, which is actually in the southern part of the district, and it's all fish and Michelin star.
How much of a nightmare is it to get around your district? I mean, I'm sorry, in California, especially in Los Angeles,
Fighting words.
we see the images of the traffic.
Traffic is tough, but just think, it's sunny, you might have a sunroof, you can also just pull over and get a great coffee. But let me tell you something, DC traffic is worse than LA traffic.
I know, we got ours too. You mentioned the 5-hour commute. I like to ask California, Oregon, and Washington State members how do you sustain that. It really is. I have to assume wear and tear for members, especially members with families. Try to do that.
Lots of movies, lots of books, meditation.
Mindfulness.
Yes, mindfulness.
Which also helps with the traffic we were just talking about.
Yes, mindfulness.
Lastly, when you're here, what do you find to be either a colleague whose intellect is a North Star for you? Who do you view to be a mentor? Who in the 535 is somebody who you think is someone you want to emulate?
Well, the smartest member of Congress is generally the quietest member because they're the one that is observing and listening. I will say I really like Joe Neguse. He is masterful, brilliant, thoughtful, professional. He's a great mentor.
Joe Neguse of Colorado, Cindy Kamlager-Dove, California. Thanks for your time.
Thank you.